Hi, I'm Darren Weiss, an attorney with Offit Kurman. Today we're talking to Param Shah, CEO of Fusiform.
Fusiform's ultimate goal is to get to the point where we have a machine within a clinic and a patient walks in, you take a scan, and you pop out the device on the spot, and that patient is walking out of the appointment with the device. This has never been done before in the industry, and we are going like the full 9 yards to get there. We do that through two product lines. The first being Fusiform Cast, which is a software solution, and Fusiform Shape, which is our hardware solution. Fusiform Cast represents the first stage in sort of this disruption in bringing that time from 1 month to the duration of the appointment. Now, essentially what Cast is, it's an online in-browser application that allows a clinic to, once a patient walks in, take a 10-minute 3D scan. We personally endorse an iPad-based, like iPad-mounted scanner that only costs $300, as opposed to the $15,000 plus scanners currently on the market. Essentially, they take a scan of the patient, they upload that scan, that 3D scan, into our Cast software, which is accessible through a web browser, and they not only fill out a digital order form for that device, but they can annotate the 3D model in space on the browser, saying, at this point, we want to address that this is a bony prominence, or we want to add more material in this place because it needs more support. And they can live message in between their central fabricator who's making that device in the end, and the central fabricator can also message back to the clinic. Creating this collaborative environment definitely speeds things up because less mistakes are occurring, everything is digital, so there's no handwritten order forms, there's no plaster, so we're reducing waste. And in the end, a proper, correct device is getting to that patient in a very efficient way. We've already have 4 or 5 clinic partners that are beta testing this, as well as one large central fabricator who has endorsed the product. And we will be launching this in May. Now, that's the first stage of the disruption to get to that ultimate solution. The second stage is the hardware, Fusiform Shape. Now, Fusiform Shape is essentially it's a hardware device, an orthotic that's built in components. Right now, every orthotic is a solid piece. Our device is made out of multiple pieces that are connected together, sort of like Legos. So we have 2 routes with that, where we can either prefabricate several components that clinics can then order in bulk, and a patient simply walks into the appointment, you find the closest fit pieces, and then you match them together, lock in the device, mold it using a heat gun, and the patient is walking out of the appointment with their device. The other route, and more moving towards that ultimate solution, is that they can put a 3D scan into our software, and our software will actually form a device around that anatomical form and produce a fully custom device for them. The ultimate goal is that we put a machine, a 3D printer, or other sort of machining device within the clinic, and all they have to do is put that scan into the software and it'll print out a device while the patient's in the waiting room.